So here we're showing you the physician side of this system, and this is shown in a dual screen mode where we have two monitors. The monitor on the left in this particular setting configuration shows the schedule, and as we indicated earlier, by looking at the schedule you can see that John Doe, patient John Doe, has just turned green. Right, and that's the patient that's waiting patiently on the other side to for the next. That shows the physician that the next available patient is ready and is there and has indicated they're ready for their encounter session. And on the other screen, we have our encounter worksheet, which is has the name of the patient, demographic information, and as we discussed, all of the vital signs that we just captured are all right here. And so you see, for example, I'll move into the frame now, so you'll see that we have the pulse rate at 67. These are all the live captured. The oxygen saturation, the ECG, and if we wanted to, we could actually take a look at that ECG, and you can see there's the strip of the ECG that we just captured, and I will minimize that and get back to the rest of the vitals here. So we have pulse, we have the respiration rate at 16 breaths per minute. That's very high for me. Interesting. I must be a little nervous, camera shy. Skin temperature, blood pressure, which is also pretty high. Beats per minute, which is again for me also high. The only thing that didn't change is my weight. So the rest of this encounter sheet has, it's a history. It has this historical information if you require it, and then it's a basic encounter sheet as any physician would do or any EMR would have. So it walks you through a number of different questions. It prompts you for various pieces of information. We designed this specific encounter sheet. And this could follow any protocol that any client group would like, or this could be the EMR that the physician's working from. In this case, we will the customer that we're working with, we're going to acquire all of this information, and as I'll show you, then we will then take that information and then send it into their EMR. So let's go ahead and begin the encounter session. I will back the camera off so you can have the view of the entire setup and with me in it, and although we don't have a person on the other side, you'll get a good idea of how this system works and how a physician would use it. So we can see that John Doe is ready, so we're going to press this large button which says Begin Encounter, and that will initiate the audio-video session and begin the actual encounter. Takes a few seconds, and now we see my lovely desk on the other side where I was working prior to making this video with my coffee cup. The reason probably my blood pressure is elevated because my second giant one of the day. And so the patient would normally be sitting here. So the physician will go through, ask them the normal questions that would be asked in an encounter. Why are you here today? How are you feeling? If it's a recurring visit with a particular chronic disease patient, go through the normal protocol that he goes through. And then what we have here is the ability to request, if let's say for example in this case, that blood pressure seems off the chart. So let's request another one. Let's go ahead and hit request another one, and what the patient will see on the other side is it's requesting another, that image comes up with a picture of the A&D blood pressure monitor, and it's requesting another one, and the patient would slide the blood pressure cuff on, and the physician can actually watch and see is the patient doing it correctly? Do they have their arm elevated? Do they have it on the left arm or the right arm, and things of that nature. So I'm going to cancel that since we don't have a live patient over there. The other thing that we could do is we could be requesting that the patient apply the stethoscope to their heart or their lung sound and be listening for heart and lung sounds, and we can be listening to that live here through the speakers or through a pair of headphones. And if required also, then we can capture snippets of that. We take 15-second snippets of that, and we can send it out to a cardiologist or a specialist to have them listen to it as well on a mobile device. We have that done for the iPhone and the Android operating system, the Android phones. So that's in a very quick and simple way. That's the system. When assuming we've gone through all these things, the physician has made notes, has progress notes, has recommendations for continued care. He types all this stuff in, enters it here. This could be done via voice as well. Enters all the information, makes the assessment, perhaps issues a prescription, and has the plan of care, and ends the encounter, says, "Thank you very much, Mr. John Doe. I'll see you next time you call, or I'll see you at your recurring visit." Ends the encounter, double checks, make sure you want to leave the encounter. The video portion of the encounter is over. Now what has happened on our screen here is all of the information that was recorded has now been compiled into a tighter and more compressed document. The physician can look this over, make sure that everything he put is correct. All of the vitals have been laid into this. And then at this point, if I want to submit the report, if we're working with a customer or a client group that has an EMR, this encounter worksheet would then be wrapped into an HL7 format and coded and transmitted to the EMR and converted into an EMR record. If we were working in an EMR, we would just close this record and it would be stored in the EMR. So we can go either way on this screen. And again, this doesn't have to be a two-screen system. We have this system also working on a laptop where the screen is just cut in half. It's just if you have a dedicated physician working in a dedicated conference center, it appears that this is more efficient and more effective, but that's a personal choice that the physician can make if they like working on two screens. One of the advantages of having one screen is that you're always looking at the camera. There is some training involved to train the physician or the caregiver to look at the camera and make sure that when they're talking to the patient that they really are truly looking at them and that the patient feels like they're not just always looking at the data. So that's partially a personal choice issue in terms of having one or two screens, and it's partially a training issue as to how to really address the patient and to make them feel comfortable. Because what we see in these kinds of systems is we believe we can do everything that's done in an actual physical examination except the touch and the feel of the human touch. So the more that the physician or caregiver is looking at the camera and really communicating and having a good bonding with the patient, the less removed they feel and the less virtual it feels. So at this point we would submit the report, it ends it, and we then go back to the scheduling, and we know, and this physician sees that there's no one else queued up, can go do some other work or talk to the scheduler and see if there's going to be some people that are coming in soon. All right, thank you very much.